to do my hand hygiene. All right, my name's Caitlin. I'm going to be your student nurse today. I'm going to be with you for about 10 to 15 minutes. I'm just going to be doing a head-to-toe assessment. Do you have any questions for me?
No.
Okay, perfect. And then to start off, what's a good name and date of birth?
Lyndon Matthews, 02-25-05.
Perfect. And then do you have any allergies?
No.
Okay, good to know. So first off, I'm just noticing my patient's posture. She's sitting upright. She doesn't seem to have any leaning towards one way or the other. I'm also noticing her mood and her behavior. She seems to be in a good mood, I guess. She's smiling. She's been engaging in some conversation with me. And then I'm also noticing her hygiene. She seems to be clean and well kept. I'm not noticing any dirtiness or anything like that. She seems to be wearing the correct clothes for the season as well. And then, are you currently in any pain right now?
No.
Okay, so out of scale from like 0 to 10, you would say 0?
Yes.
Okay, perfect. And then I'm also not noticing any lines, tubes, or draining. To start off, I'm just gonna ask you a couple questions. Do you know where you are right now?
Yeah, I'm in the sorority house, Springfield, Missouri.
Perfect. Do you know what today's date is, or at least like what day of the week it is?
It's Monday.
Okay, perfect. And then do you know who the president is?
Yeah, it's Trump.
Okay, perfect. All right, so she seems to be alert and oriented ×3. She's answering all my questions. She's not seeming to have any concerns there. And then I'm just gonna have you smile for me. Perfect. The smile's symmetric and equal on both sides. And then I'm also I've been assessing her speech. She's, again, had clear speech with me, conversations and everything. And then I am gonna assess your strength. So I'm just gonna have you hold my hands. I'm gonna have you pull me towards you and push me away. Perfect. And I'm gonna have you push your head against my hand, whatever. And then the other side. Perfect. And I'm also gonna have you put your feet out a little bit, and I'm gonna have you pull your toes up and then push down on the pedals. Perfect. The strength was strong in all of the 4 extremities. And then now I'm just going to check your sensorium. So I'm just gonna use my pen light and I'm gonna tap a different part of your body, and I'm just gonna have you tell me which side and what part it was, okay? So if you can close to your eyes for me.
Right arm, left leg, left arm, left leg.
I'm also gonna touch your face, just warning.
Forehead, left cheek, nose, right cheek, and chin.
Perfect. The sensorium was good in all of the regions, the lower, upper, and the head. And now I'm just gonna go ahead and do a quick head and face assessment. So I'm just gonna look in your hair first, if that's okay.
Mm-hmm.
Okay. So I'm looking, noticing there's no lesions. I'm not noticing any redness, any irregularities in the skin and the hair growth. All right, perfect. And now I'm just gonna look at, also your head is neurocephalic, which is what we're looking for too.
Mm-hmm.
Now I'm just going to look at your eyes, so I'm just gonna have you look at me. I'm gonna shine the light. Perfect, and I'm gonna do the other one. Perfect, so your pupils are round, they're reactive to the light, they're equal in size, and they were also accommodating, which just means that they were dilating and everything.
Mm-hmm.
And then do you have any glasses or contacts that you wear?
No.
Okay, perfect. And now I'm just gonna look at your eyes. Could you pull your eyelids down real quick? Perfect. All right, the conjunctiva is pink and moist. The eyelashes look well kept as well. I'm not noticing any crust, any drainage or anything, no abrasions on the eyes or anything. And then I'm also just gonna check your ears as well.
Okay.
And I noticed, do you have 2 piercings?
Yes.
Okay. On both sides?
Yes.
Okay. Perfect. All right. Yeah, I'm not noticing any drainage out of the ears or the piercing sites. And I didn't see any obstructions. And do you have hearing aids?
No.
Okay, perfect. So no hearing deficits. Okay, good to know. Right, and then now I'm just going to look in your nose. So I'm just going to shine the light just to make sure there's no obstructions. Sorry if it's in your eyes, sorry. All right, no obstructions in the nasal airways. I didn't see anything there. And then also, could you close one nostril and breathe out for me? And then do the other side as well. Perfect. I didn't see any flaring or any abnormalities there. And then I'm also gonna have you open your mouth, and I'm just gonna check out Again, oral cavity is moist and pink. I noticed that there's no lesions, any abrasions in the mouth. The tongue is center in the midline. I think that's it for that. So now I'm just gonna move on to the cardiovascular. So it's okay. I'm just gonna have you put your hands out like that. I'm gonna check your cap refill. Do it again. Perfect. Less than 3 seconds. And then I'm also gonna do it on your toes. Less than 3 seconds again. Perfect. All right, so all the cap refill were less than 3 seconds, which is exactly what we're looking for. And I'm also just gonna have you hold out your arms like this. I'm gonna assess your pulses. I'm gonna lift your, so this is your radial first. Perfect, that was normal. There's 2+ strength-wise. I'll lift this up just a little bit more. I'm gonna do the same on your brachials. Again, 2+, strong and equal. And then I'm also going to do your pedal pulses real quick. Perfect. So all of the 3 places where I checked, they were all strength and equal of 2. And then I am now going to listen to your heart real quick. All right, so I'm going to start on this side. Perfect. I didn't hear any abnormal sounds, any extra sounds. It was clear sounds. The strength was, again, the same in all the 5 places. And then now I'm just going to have you look off to that side for me. And then go ahead and look this way. Thank you. Perfect. Didn't see any jugular vein distension. And then now I'm just going to palpate and feel your carotid arteries. So I'm going to do this side first. I'm going to do this side. Perfect. They were bilateral and equal again. And then I'm just going to listen for what we call it bruits and swooshes. It's going to be on your carotid again. Perfect. I didn't hear any, which is again what we're looking for. Right, and now I'm going to move on to respiratory. So I've noticed that my patient's respiratory rate is between 12 and 20, which is what we're looking for. And then I also noticed that her work of breathing is unlabored. It's equal bilaterally on both sides. I haven't noticed any unsymmetrical factors, whether it be raising or lowering of the chest. And I also haven't noticed any concaving or barreling of the chest. Right, and now I'm just going to listen to your lung sounds real quick. So I'll just listen to 4 parts, front and back, and whenever I place it, I'm just going to have you take a deep breath, okay? Perfect. And then now I'm just going to have you turn that way a little bit. Or whichever way, yeah, that works. And I'll just have you lift up this arm for me. Deep breath. Perfect. And then now I'm just going to do it on your back as well. All right, perfect. I didn't hear any wheezing or any pneumothorax, hemothoraxes, nothing abnormal that I shouldn't hear, and they were all crisp and clear. And then, have you recently had a cough or anything recently?
No.
Okay. And if you did, were to have a cough, if you had sputum, it would be pale yellowish, and that would be fine, just so you know. All right. So now I'm gonna assess your abdomen. So when was the last time you had a bowel movement?
Probably about an hour ago.
Okay, perfect. How many times do you normally have one a day?
Once.
Once, okay. And then how about urination?
Usually around 6.
Okay, 6 times. Okay, and like, this is weird, but how would you describe the urine? Like color, consistency?
Like light yellow.
Light yellow. Okay, and like no smell or anything. Okay, good. Perfect. So now I'm just gonna have you lay down, and I will raise your shirt if that's okay.
Yeah, fine.
Oh, sorry. Perfect. So I'm noticing the abdomen, the contour. There's some there's some abdominal muscles that I can see. Other than that, I'm not seeing any like distension in the stomach. I've also noticed that it's flat in shape. All right, and then now I'm just going to listen to your stomach. So I'm gonna start here. All right, all 4 regions I heard. I did hear some hypoactive sounds, but it's just because you just had one, so it's okay. All right, and then now I'm just going to palpate, so I'm just gonna press on your stomach real quick. Just let me know if you feel any tenderness. Okay, perfect. I didn't feel any masses or anything, so you can go ahead and sit up now. I didn't feel any masses. I didn't feel anything that wasn't supposed to be there. All right, and then now I'm just gonna test your musculoskeletal system. So I'm just gonna test like your range of motion first. So I'm gonna have you turn that way again. And I'm gonna put my hands right here, and I'm gonna have you put your hands above your head. All the way up, perfect. Down to the sides. Out beside you and in front of you. Perfect. So I didn't feel any like abnormalities. I felt some of the tendons, but that's normal. That's just because you're moving around. And then I'm gonna have you look to the side, look to the other side, and then up and down. Perfect. Neck and spine also has good range of motion. And then I'm also going to place my hands right here, and I'm gonna have you straighten your legs. All right, and then bend them. Perfect. Didn't notice any issues there as well. So now I'm gonna have you stand up, and then I'm gonna just have you stand right here and walk over to the other side of the rug. Okay, it looks steady. And then I'm gonna have you turn around, and I'm gonna have you do heel to toe. Perfect. Again, gait is steady. I didn't notice leaning on one side or the other. And then I'll just have you sit back down again. Thank you. All right, so now I'm just gonna kind of assess your skin. I've been looking throughout the whole thing. You have a palish pinkish skin color. I didn't notice any like excess moisture. The skin was warm, which is what we're looking for. And then I am gonna ask for your hand real quick just to check your skin turgor. Perfect. So like about a centimeter raised, but it didn't stay, so that's also what we're looking for. And then I didn't notice any lesions, scarring, or anything throughout the body, any discolorations. All right, well, I'll let the doctor know that you're ready.
Okay, perfect. Thank you.
Yeah, hand hygiene.